All right, can everybody hear me? All right, I'm seeing people are starting to log in. I'm just, you can unmute yourself and say hi. Hopefully everybody can hear me.
Yeah, we can hear you.
Good.
Oh, well, look at me.
There's somebody's face we can see. So I'm hitting you to where you can either mute yourself or you can stay unmuted. If you do have a lot of background noise, if you just go ahead and mute your microphone, and then you can just hit it when you want to participate. Would be happy to have participation. Give it about one more minute and then we'll get going. While we're waiting, let's see who we have from where. I'm in the state of Washington, so who's the closest to the state of Washington? No one? All right, who's the farthest from the state of Washington? Okay, so we're going to go ahead and begin. Today we're still continuing with the kind of the basics foundations, and we're going through the foundations of Fusion. And so last time we discussed, before we had our little break with our visual perceptual skills, we talked about red, green, and luster, gross peripheral fusion, kind of the foundation of it. So I want to ask this question. People can either type it into the chat, or you can take your mic, unmute yourself and answer this question. But what are the two things that it takes for fusion? What are the two things that you have to have? Anybody? I'm not hearing anybody anymore. Are we having technical difficulties? Okay, I'll just ask somebody. So I have Samantha. Can you unmute and just make sure that you can hear me and I can hear you?
I can hear you.
Okay, so good. So does anybody have an answer as far as to what are the two things that you have to have for fusion? All right, here's the chat. There we go. So I can see the chat. I don't see an answer in it yet. Oh, somebody's from Morocco. Welcome. Okay, I'll give them to you. So remember, we have to have motor alignment. Okay, so the two eyes have to align together, and then there has to be sensory fusion, okay? So motor alignment is the mechanics of it, okay? Sensory fusion, that all happens within the brain, within that visual system. So gross peripheral fusion, you're just taking that whole area, okay, and we're just kind of overlapping that red and that green, and we're creating a new picture, that luster color. And as we talked about, they can have a different one or different color. Some have the orange, some can get pure white, some will say it's a different color, but you're wanting a blending of those two colors. So now in continuation of that, again, you're doing vectograms, projected, all gross peripheral fusion targets, and now we're starting to work more central and more central until now we're going to start to introduce fusion cards, okay? So the fusion cards that we normally use, and these are the ones that come in the Emergent kit, so I'm going to be using them. You've seen many different types of fusion cards, but we know that there's the Lifesaver Card, okay, and I'm just putting a white piece of paper behind it. I tend to like transparencies because it just seems to be easier if you want them to diverge for them to be able to look through it. And then on Convergence, I want them to have the control to be able to converge even though that they have something in the background. But if you need to, in any of these instances where you're using a transparency, you can use a piece of white paper behind it. So I'll hold this one up. This one has fusion thread on it, and then it has the pyramid and then the pool balls. Either one of these, okay, this one doesn't have it very much of any depth perception. There'll be a little bit of silo with the different size of the head in the middle, depending on if you're converging or diverging. With the trapezoid or with the pyramid, you will get some depth perception as it pops in or pops out. And the pool balls, you'll get a little bit more depth perception in that one. And then probably the one that I use the most is the eccentric circles, and we're going to talk about them in a little bit more detail coming up. So in fusion cards, a lot of times I've already been building to this part, okay? So even in these webinars, we've talked about FizzDip, being able to look past an object and see that there's two there, okay? Or being able to look at it and hold maybe another pin or another wolf wand behind. So if I'm looking at the near one, I'm converging, and then in my distance, I have two, giving me FizzDip in distance, or if I look at the far one, I have FizzDip close. So FizzDip is also something that we would be doing before we would do fusion cards. And then Brock string, okay? Because the Brock string, as we talked about it, that is so much information on motor alignment. Where are their eyes crossing on that X? Are they isophoric, posturing before in front of where they think they're looking? Are they exophoric, posturing behind? We work on suppression, being able to make sure that both cameras are on, and now they have some sort of skills of alignment. And with the Brock string, I've already worked with them as far as being able to know when their eyes are converging and coming in. And this goes all the way back to Marsden ball, okay? Does your eyes feel different when the ball's swinging towards you? Do your eyes feel different when the ball is swinging away from you? So I would never introduce fusion cards to anybody that you haven't already done some sort of skills of motor alignment, okay? Knowing what convergence is, knowing what divergence is, because now we're transitioning from just aligning of the eyes to get to that central get to that fusion aspect. Usually when I'm introducing fusion cards, I'll start with fusion thread, okay? And I'll do it this way just so that you can see it and you can still see me through instead of seeing a piece of paper. But if I'm working convergence, if need be, then yes, I would make it so that there's an opaque background to it so that they don't have the distraction from the back if that's what they need. Or if I'm doing divergence, I probably would not, so that I can just have them look straight forward. Okay, so doing this activity, multiple different ways that you can do it. You can load it in any of the ways we've talked about. Static is just having them sit. You can have them stand. That would add a vestibular aspect to it. As you begin to load it, you can load it with vestibular, putting on balance. You can have them walking through space. But really, when I'm first introducing it to them, probably we're just going to be sitting there and I'm going to have them hold it, okay? And it's going to be up in front of their eyes. And then I kind of stand to the side. And at first I just say, hey, can you look through the target back here and see if you can get that into, and tell me what you see. I don't try to preload them. I just have them look through it and tell me what you can see. If anybody has any questions at any time, you can always chime in, okay? Now, just having them look straight through, that might be difficult. Now, in our clinic up in Yakima, I had a window that was behind me. And so I would actually have them look at the building behind me and pick something on that and then be able to look at it. And that would help them to get a good depth of field. But if you don't have that, the other thing that you can do is just take your wolf wand and put it right behind the picture, okay? So your patient's sitting here and they're holding this, looking through it. I just take that wolf wand and set it right there in between and have them keep their eyes on it. And then I would have them watch the wolf wand as I'm pulling it back away from them. And as they keep their eyes on the wolf wand, pretty soon they're going to have fizz dip. This one's going to double, this one's going to double, and it should create that image. And I'm asking them to tell me what they see. Okay, so as we go through that, I'll ask them, do you see one wolf wand? Yes. Okay, how many faces do you see? Well, I see one with eyes and one with a mouth. Okay, I want you to watch that wolf wand and tell me when things change. And somewhere around in here, they'll say, oh, there's 4 heads. Okay, then I know that they're starting to see that fizz dip. And then as I keep going back, usually when I get about that far away, pretty soon they should be diverged enough that they will be able to overlap that diplopia, okay? And now that's when sensory fusion takes place and it locks in, and they'll say, oh, I've got 3, okay? Right when they get 3, I say, okay, can you hold it? And so they'll sit there and they'll go, you know, oh, lost it, okay? So we'll do it again. And so the main thing that I'm doing at the first is, can they get it? And then how long can they hold it? And so we'll count 1, 2, 3, 4, you know, however many seconds. And my goal right at first is 10 seconds, but it may be only 3 or 4 seconds and they're losing it. That's fine. Don't rush it, okay? If they lose it, just have them kind of do their ions, kind of relax again, relax the system, then have them put it back up. And I'm like, now, do you remember where your eyes were pointing? Can you kind of remember that feeling of where your eyes were pointing? That's where I want you to point your eyes and see if now, and I will try to open their periphery using snapping, have them tap their feet, and I'll see if they can actually point their eyes back here without having the wolf wand in there. If not, we'll go back to the wolf wand and then we'll just pull that back out until they get it, okay? Now, once they can hold it for 10 seconds, okay, they're able to get that 10 seconds, then I'll go and say, okay, now what I want you to do is get it and see if they can get it without the wolf wand, okay? If they got it, then immediately I'll have them turn away. So they turn their head to the side or they look up the ceiling, wherever it is, and then I'll say, okay, now I want you to get it back as fast as you can. So I'll sit there and if I'm looking through this, okay, I've got Fusion Fred, I'm diverged, I can feel the difference. I look away, and then when I say go, the patient would go, got it, okay? And so this is how much recovery time or how much time does it take to get their eyes to go back where they knew that they had fusion before. So we're trying to incorporate that proprioception of knowing where the eyes are positioned at, the feeling of that. And to me, it's not just, can I get fusion if I work hard enough and I look at these different things, but can I, with my eyes, just naturally know, okay, I'm going to diverge my eyes, boom, there it is. I know exactly where my eyes need to go. That's the kind of control that we're wanting to give them. Now, I will work divergence a little bit first because it seems to me and other people, there's different ones. I know that every patient's different. But it seems to me it's easier to help them with divergence first because then they're just relaxing their eyes. And then we'll go to convergence, okay? And so convergence, again, just working with Fusion Fred. talking to them about the Brock strain? Do you remember looking at that close speed? Can you position your eyes like you're looking at that close speed and see if they can just naturally have that feeling of what it means to converge, what it means to put their eyes into a state of convergence? If they can't, usually instead of the big part of the ball, I'll flip it up and make it a smaller point, and I'll just have them hold it in their hands, and I'll turn a little bit to the side so you can see it from the side, and I'll have them put it there, and then all of a sudden they just keep their eyes on the red, on the red, on the red, and as their eyes, okay, now I got it. Now when they say they have 3, I'll ask them, how many pointers do you have? Okay, because the thing that you're looking for is you do want to have pretty good localization. Okay, so as they're coming through and they're looking at that red, and all of a sudden they're like, okay, I've got 3 faces, and then they say, well, I got 2 pointers. Well, then we know that their convergence isn't in line with where their eyes are. Okay, so that they're not localizing. So right here I have 3. Okay, so I have 3 faces, but I have 2 pointers. I'm going to bring that pointer out, and now right here in this space where there's 1 pointer, okay, and 3 faces, but this face that's popping out at me is right here. I want to have good localization that I know where those 2 eyes are coming together. Okay, now they should be reporting that they have a face, they have the eyes, they have the mouth, they have the hair, everything's there. And they should also be reporting that they have a face over on this side that's a little bit farther back that has no eyes, and then a face over here that has no mouth. Okay, so you still want them to have those 2 side pictures, the FISDIP pictures, but you want to have that fusion picture that's coming out at them, and have that silo effect. Okay, do they see that it is actually closer to them than those other 2? Do they recognize that the head of Fusion Fred is smaller? Okay, now on divergence, going back real quick, there is a little bit of depth perception. Okay, there's a little bit of fade that you can see that they're a little bit farther back, but it is a little bit harder for them to see. And then on the size, it's not going to be as dramatic. Okay, so it's not like that head in the middle is going to be super big and they're going to really notice that. This is a just noticeable different size when you're doing that divergence. Okay, so same protocols. Once I can get them to do it, how long can they hold that convergence? We count it out. Once they're consistently able to hold it for 10 seconds, then I would have them, now they start with the pointer and say, I've got it, I'm localized. Okay, now can I take the pointer out of the way and still hold it? Okay, can I take the pointer out of the way and still have 3 heads, Fusion Fred, popping out at me, haven't lost any? A lot of times this is where it's tricky. Okay, because they're using the pointer, they're looking at the pointer. So now when they go to move the pointer, they naturally want their eyes to follow the pointer and they lose it. So little tricks that we've learned is, if you can get them to do it, is once they have it, just have them start to look at Fusion Fred and then tilt the pointer to their chin. So it just comes out of their field of vision. And so now that they can hold it and they can keep that, okay, and keep that out of the way. Once they can hold it for 10 seconds, we're going to go through the same thing as far as, can they get it on their own? I've got 3. I look away. I go, they look back and got it. Okay. And when they say they got it, then they have to localize it so that they know where in space their eyes are when they're converged, and really being able to feel that difference and feel where those eyes are. Okay. Once they can get it pretty well, then I'll have them stand. Okay, and now it's going to be hard to stand because I'll lose the camera, but you can have them stand, and now they're standing and they're holding it. They go through, have that vestibular input, have them now diverge, and then have them turn and kind of turn in space. And can they hold it while they're moving around the room with that in there, with that in front of them? Can they keep fusion in their eyes where they want it to be? Same with convergence. Can they converge, localize, know where it is, and then be able to turn their body and their head and their whole body and walk? You can have them walk around the room while they're holding fusion. Then I'll put them on a balance board. Okay, So now they have a balance board that goes forward, backwards, right and left. And now can they stand on that balance board and keep that balance while they're doing their fusion cards, okay? The last stage that I do with fusion cards is we actually make an obstacle course. And so I'll have balance boards and balance beams, and I put bean bags out on the floor, and then I have Marston balls that are swinging. And so now they have to hold their fusion card, diverge it, walk through the course, get up on the balance board, balance it, teeter totter, however I have it set up, walk the balance beam, not step on the bean bags, be able to step in the hoops that I put out for them, all the time holding fusion where they want, whether it's convergence or divergence, okay? So that's kind of fusion, Fred. The other two are gonna be the exact same, okay? The difference is gonna be, is they're gonna have more stereopsis, they're gonna have greater depth, being able to identify where that is in space and being able to work through those. Now, once I do fusion, Fred, I may hit these, you know, give or take, but a lot of it, I go to the eccentric circles, okay? I really like these. I like the depth that it gives. I like the understanding it gives. It has the clear that's written in it so that you have a little bit of an accommodative check and a central suppression check. You have the star above. You also have the circle below, so that it really gives lots of different checks. And as they look through it, they're diverged. Can they get it out? And I'll give them a more of a dowel. You know, I like the long dowels, about a yard long. And they have to reach out and touch where that far circle is. So when they're diverged, the biggest circle should be closer. The little circle should be farthest away. And then can they also clear the word that's in the center of them, okay? And the reason is they are diverged, which is correct, but their accommodation is always going to be at the plane of regard, okay? So the plane of regard is where those letters are. So this is my plane of regard. So even though I'm diverged past it, I still have to keep my accommodation as if it was at Harmon's distance, okay? So if they say, yep, I've got it, but it's really, really blurry, that may be fine at first. It probably means that their accommodation has followed their divergence. They're just relaxed out in both their vergence, okay, and in their accommodation. But to be able to hold that accommodation in and keep those letters clear. Then to converge, if they wanted to converge, being able to localize, now the biggest one should be farther, the small one should be closer, and now they're going to have to make sure that when they don't overflex their accommodation, that they still keep their accommodation out here at the plane of regard, okay? Lots of things that you can do with this one. You can go through the same. If you're doing divergence, you can have them, you know, if they're standing here, you can put this and have them follow that out. Other way for divergence is I will take and go to a window. We have a window that goes out to the parking lot. I was at a clinic down in Idaho, and they had a window that went out to a street, to a road. And it's really easy to just take a piece of tape and put this on a window. And then they're standing in front of that window. And what's nice about it is when they look out, those images will pop out. And now you can ask them questions like, are the circles inside the building? Are the circles outside the building? If they're diverging, they should be outside the building, okay? How far outside the building? If they say, well, it's only like 1 or 2 feet outside the building, then you know that they really have a very narrow depth field, okay? We want them to be able to totally relax out to where those circles, they look like they're way out in the parking lot. A lot of times I can get them close to 60 feet out, that they'll be able to see those circles and feel like they're out there by those parked cars, okay? So great way to do divergence when you're using these. Convergence, of course, is going to be the distance that you have, but make sure that they're localizing it and touching it. And then amplitude is how much they can do, how far they can go, but then also make sure that you work facility, that you can have that flexibility. And so I'll have them converge, localize, diverge, where is it at? Converge, localize, diverge, where is it at? Okay, so that they're able to say by themselves, I want my eyes converged, I bring it in. I want my eyes diverged, I bring it out. One way that you can kind of do an upper load on this is I'll put a heart chart up on a whiteboard. I will give them one of these and I'll have them look at the heart chart, read the first line, converge, localize, relax, read the second line, look over to the side, diverge, see where it's at, touch it with the pole so they can see how far out they have it, read the next line, converge, and just keep going back and forth so that I have vergence in, reading, vergence out, reading, vergence in. So we're utilizing convergence, divergence, ocular motor, accommodation, all kind of in sync so that they get this big load of different activities all in one activity. Okay. Any questions on those? Okay. Lifesaver card. Now, I know in a lot of places, and probably even when I first started, Lifesaver card was kind of one of the first ones we did because it's kind of nice, especially if you put the opaque behind it. It's red-green, right? So it's really easy to be able to identify which one side they're suppressing, okay? So if you're looking at it, you have your small circles, then your next circles, next, okay? So these ones here, depending on if you're converging or diverging, it's supposed to be like easier, next, and then this would be the hardest. Be very careful if you're diverging, this top one, if you have a young child, you can only diverge to your pupillary distance, right? We never want to have somebody diverge past what their natural pupillary distance should be, okay? That would create exophoria or even an exotropia, okay? So you may have to just be satisfied if they can diverge this third line, that may be as far as they can go, okay? But in this one, what is good about it, okay? So let's say I'm diverging it, and I like to diverge without anything behind. They should be able to recognize I have a red one here, I have a green one here, and then I have a blend of colors here in the middle, okay? The difficulty with this one is I'm gonna hold it. Do you guys see both cameras? Can you see that up in front of that camera? I hope so. All right, or I can hold it out there. I know we all have these, but in this one it has clear these letters and some of the letters are missing and then some of the letters are bigger and offset differently. This is really fine detail and is very parvo, okay? It's very central. So when I'm, the whole thing about going gross peripheral to central, getting them to clear these letters and not suppress these, this is very fine fusion, okay? So this is really technical, okay? This takes a lot of just good motor alignment and then clarity, accommodation, everything else. So whereas the red-green is a good beginning one to see if they're suppressing or can they get that blend, we're working off the red-green luster, the small letters and the central fusion part of it is probably too soon, too fast, especially if you're working with an esotrope or you're working with somebody that amblyopic, that we're really not wanting to awaken that central fusion until we really have motor alignment and sensory fusion mastered and all the other ones, okay? So it's still good, it's still used, and I use it more as a finishing than as a beginning one. So those are fusion cards, but what if fusion cards don't work, okay? What if you started all that and from the very beginning and just like, hey, I'm not getting this, they're not getting it, it's just, they're not able to get the motor alignment automatically, okay? There's a couple tools that I want to show you. One I'll show you briefly, and the other one I'll show you more in depth. The one that I'm going to show you a little bit more brief, this is called a W scope, okay? And so I'm going to lay it out here and then kind of, let me flip it around here. So as you can see, there's mirrors here, These are mirrors. And then you have your targets on the side, okay? So the goal is this goes towards their nose, and I'm going to demonstrate it in a minute. Their eyes are looking in the mirrors are looking at the targets here. So if we think about before there can be sensory fusion, there has to be motor alignment. Well, what if you have somebody that can't motor align? Maybe they're an exotrope and they just haven't figured out how to pull that eye in, or they're an esotrope and you've gotten a little bit of movement out, but not a lot. And so you're trying to now, I want to get fusion. I want them to be able to see stereopsis. I want them to be able to feel what that is. And then I'm going to use that feeling of stereopsis and that fusion to start widening and then getting their eyes more ortho. Well, because of the construction, if I have somebody that's a little bit esotropic on one side, I can move this so that I'm aligning the target into their foveal area to help them gain fovea to fovea fusion, okay? Or if they're esotropic, I can move one in, okay, depending on where I need to go to help them to gain that overlapping, okay? So it's gonna look a little bit funny, but basically you put it down on the table, and now by bringing this in, I'm adjusting pupillary distance, okay? So I'm bringing it into where they can get, and then by controlling these wings, I'm bringing it into where they can get fusion. So now I bring that in, and now I have, you see an eccentric circle on this side, eccentric circle on that side. So now I bring it in, they overlap, and now I have fusion. And I'm just looking straight ahead, and I can make it to where I'm diverging, so I'm just relaxing my eyes. Or as I bring both of these in equally, it's raising that towards me, and I have to converge my eyes to keep it single, okay? So this is called a W scope, or that's what we call it in our clinic. It does come, you can get them from Burnell, and it does have this grid on the bottom that will help as far as knowing, you know, the scale of divergence and the scale of convergence. Personally, I have not used that a lot. I usually more use it in this method here of just straight, because I'm not really checking diopters, okay? I'm not checking how much fusion they're getting. All I'm using this for is to help with motor alignment that they can't do themselves, to get fusion so that I can help them, and then later on through the vectograms, VTS4, all those other ways that I can measure a little bit closer what kind of diopters of prism that I'm giving them for depth, okay? So this is a W scope, and it just allows them to hold and allows them to manipulate the sides so that they can get good fusion, and that's just right there in front of their eyes, okay? So that's a W scope. What I want to spend a little bit more time on is this is called an Aperture ruler trainer, okay? And we call it the ART, okay? And the reason why it's called an aperture is because you have two different apertures that you can look at. You could have one, or you can have two, okay? So if you think about it, all of us have two eyes, right? And we want them all to work together. So if two eyes are coming into one window, then those eyes are going to have to converge, okay? If we have two eyes and they're each going to go to a separate window, then we know they're going to diverge, okay? So a lot of times I've already worked with fusion cards a little bit, but they're struggling with that. They're not sure how to get their eyes to come together or where to point their eyes to create that fusion. This helps us, okay? It also helps us to know about how much demand that we're putting them on, okay? So again, we get these from Burnell. Each card, if you just look at the card itself, what does that look like? It looks, let me put this behind it, okay? It looks like a fusion card, okay? So basically this is just a bunch of fusion cards that are spread out a little bit more, giving more and more demand, okay? And the same fusion card can be used for convergence or divergence. So it just depends on what aperture you use. I tend to start with convergence because I want to end with divergence, okay? in all my therapy, I try to end them in a relaxed state. So I usually will not do accommodation activities at the last of their session. If I do an accommodation activity, I always end with a plus lens so that they relax their accommodation out. I don't want them leaving my office having finished with accommodative activities that caused them stress or brought them in, or convergence activities that brought them in. I want them to leave in a relaxed state. So we'll usually start with convergence. And the neat thing is on each card, this is number 2, okay? It tells me where to place it on the ruler, and then it tells me where to place this. So it says to place it between 1 and 2, okay? So I go down here and I set it on that first one. Now, the patient is going to put their nose at this end, look through the target, and that's where their fusion is going to take place, okay? So I'm going to turn a little bit to the side. Hopefully you can see this. They can adjust it. They can adjust it however is comfortable with them. But the main thing that I'm wanting them to do is both eyes, I'm going to use this to kind of point out, both eyes have to come into this window. Now, what they want to do is they want to look into this window all the way back to here, okay? But if they get their eyes all the way back to here, they're not going to have fusion, okay? There's not going to be any depth. There's not going to be a blending of the two pictures, okay? So what I want them to do, and maybe I'll give them a pointer or give them something that they can use, a pen, and I'll put it right here at the window. And I'll ask them, look at that pen, look at that pointer. And that will help them to now, I've blended both pictures into one, and now they should be able to reach out and localize and touch. So in this one, we have a parrot. Some of you are probably familiar with it. But if they localize and they're touching the board back here, that means they're not getting any stereo. They're not seeing that depth. They're not feeling that yet. And so you want them to be able to get it and then be able to feel where that parrot is. Now, some in our clinic, they have gone in and they've kind of put some color on one part of the bird and color on the other part of the bird. You can do that. That will help with saturation and help give them a little bit more detail and really help with knowing if they're suppressing. If they say, I only see a green bird, then you know that they're suppressing the one that has the red on it. But even if they don't have those two things, the way you know if they're suppressing is, one, they won't be able to localize where it is. Then at the bottom, they should have a plus symbol and a dot. And then there's 2 eccentric circles. The big one should be further away. The small one should be closer to them. So every one of these cards give us multiple things of feedback to know where it is. And again, I'll start, ask them if they can get it. Now we'll see how long they can hold it. Maybe it's 1 second, 2 seconds, 3 seconds, 4 seconds. I try to see if I can get them up to that 10 seconds. I'm always interested in localization. Now, when that pops out, it almost makes like a hologram out here. And so I'll say, hey, can you tickle that bird? Can you feel, where that is? And when I say feeling, it's not like they're going to come up against resistance, but do they feel that their proprioception, where they're putting this at, is at the same place where their eye is telling them where that's at, okay? And so then they'll get that one. And the next thing I'd do is I'd have them look away, okay, and say, go. And then they look back, got it, okay? How long does it take them from when they look away to looking back to remember where they put their eyes in order to get that? Once they have that, very simple. You just flip that card over. Now it says to slide it to 3. So now you brought it to 3. Now they have a greater convergence demand, because the closer that window gets to them, the more their eyes have to come together to get through that window or through that aperture. Okay, so now then I ask them, okay, what do you see? I see one golfer. He's right about here. He's got blue pants and a red hat. So I have all the colors. The small one is popping out at me. They have depth. They can feel where all those are, okay? And we just work through each one. Each card is going to give more and more convergence demand, and as they work out. Now, this will go all the way up. I think that there's one that is the lion or tiger. Oh, no, the last one is a well house. That's 12, okay? That's way up here. Now, if you think about it, how often do we really want anybody converging something this close, okay? So I tend to stop around 10, okay? So about that much. I'm not saying that you have to do that. You can do whatever you feel like and whatever your doctor recommends, but try to remember everything that we're doing is to equip them for real life. And so in real life, I really don't want them converging 2 inches off their nose. And so I don't usually tend to go that way. Okay. Now it's convergence. Then going back, I would take this one off. And on this one, you see one side has a dot, one side doesn't, okay? So you can look at it, some feel like the dot is a help, some feel the dot is a distraction, okay? I use the dot at first because when I put this here, so I'm on the 1 and the 2, just like my card tells me to do, the very first thing is I tell them to look at the dot, okay? Then I say diverge the dot until you feel like you have fizz dip, okay? That dot gives a fizz dip mark. So now they diverge, they got a white dot on one side and a white dot on the other side, and they have the bird that is sitting right between the dots, okay? So it's kind of a reference point, it's kind of an easier way to transition them in, but I do get them to the place where I can now take that off and only give them the black side and bring that. And now let's say we'll go to the next one. So that one should be at 3. And so now they have to diverge their eyes, okay, until they have one golfer. Now the divergence is a little bit difficult, more difficult, I would say, on localization, but it's still very important that they correspond the feeling with their eyes to where in space they feel that they're looking. So I'll give them something to point with, and once they have it diverged and they got one, then they have to take and kind of feel where that feels like, okay? And so I felt it was right about here, and the way that I measure that is the distance between here and here should equal the same distance from here to here, okay? So this amount of space, they should have about that much space behind it. And then as it goes, it gets further and further and further out, okay? Once they're able to localize, and I'm pretty good at knowing that they know where it is, some of the higher ones, they're not going to be able to reach far enough to get that. So then I go to diverge, hold it. Can they hold it for 10 seconds? Okay, they can do that, not a problem. Now look away, ready, go, diverged, diverged, okay? So that how fast can they go from back and forth, being able to get it back. The other thing that this can do is now you can get them and you can have them stand with it. You can have them walk with it. They can diverge as they're holding this. It's a little bit more awkward than holding just a fusion card, but it does give them more information of where to point their eyes, how to point their eyes, and what to do with their eyes, okay? Then the final thing that I do with this, and let me grab something real quick, sorry. Is the ART is a great tool for BOP and BIM. So I would start, I have my trial lens set there, and going convergence or divergence. If we're doing convergence, just put this back, match it. So there's 3, match this one on 3. And then I start with a plus if I'm doing convergence. So base out with plus, base in with minus. So divergence, I would use the minus side. Base out, I would use the plus side. If they're struggling with it, you can use both sides and rock it back and forth. I start with a plus minus 0.25, so just a quarter diopter. And basically they're going to sit there and they get it, and then they just say single, clear. Single, clear, single, clear, single, clear. So adding that accommodative load, does it cause their vergence to split? So the main thing that I want them to do is keep it single. Secondary is, can they make it clear, okay? And then we'd go through. Once they can do a quarter diopter, then I'd give them a 50, okay? Then I'd give them a 75, and I'd give them a 1. And we'd just work those ways up. The reason I don't just start out with a 1 or a 2, and if they can do it, it's all great, is it's not the action, okay? So it's not the activity, okay, that they can just do it. It's really, do they feel what they do differently, okay? When that minus lens comes in, when they're diverging, can they feel that they have to keep their eyes diverged while they're accommodating a little bit more? If they're converging, do they feel that they have to relax their accommodation but not relax their vergence, okay? So we're getting a little bit of separation between the vergent system and the accommodation system. And so with all these activities, except for the W scope, we would finish it off with BOP and BIM, doing small to larger. And then I personally never go over a ±2. I feel like with a ±2, if they can separate that much out, that's all that I'm looking for. Once they can do that with an ART, then I would go back to my eccentric circles, and I would again have them converge, okay? And then can they clear single, clear single, clear single, clear single. It's getting harder for me to clear minus. All right, so then again, go through all the different levels of loading, standing, walking, balancing, and finally going through that maze as they're doing BOP and BIM with Fusion Cards. So that's kind of how that final finishing stage that we go. So that's the next little area of Fusion Cards, and then a couple other tools, but mainly using the ART. Are there people out there that use the ART? Okay, so there are a couple questions. Do you consider the Aperture rule as a tool to be done at the end of therapy? Not exactly, because what I'm going to take that at the end of therapy as what you mean by after they've been in therapy for a while and you're using it at the end, or are you thinking about at the end of each therapy session? Okay, I'll answer both. I use the Aperture ruler trainer as soon as I start utilizing Fusion Cards, because if they're struggling with Fusion Cards, that's my go-to to help them learn how to align and everything else. If they're not struggling with Fusion Cards, then that's what I go to start working on BOP and BIM, okay? Particular age group, can we start using the ART? They have to be old enough that they can kind of communicate what they're doing and what they're feeling and how they're doing. My youngest that I've used an Aperture ruler trainer on has been about 7 or 8, but that was an exceptional student, because a lot of fusion, especially this type of fusion where you're basically you're needing them to respond to you and tell you what they're doing. 8 and 9, that's the time that we start looking at that towards. So I do use this anywhere from that 7 years of age, 8 years of age, all the way through. Now, when you get to adults, the one thing that you're going to have to remember is if they have bifocals or if they have progressive lenses, the ART gets a little bit difficult because of how you have to handle giving them the add that they need to be able to make things clear. Okay, so on those patients, a lot of times I will tell them I don't care if it's blurry. I'll allow them to have it blurry because that is an accommodative thing that they can't do differently because of presbyopia, but I want them to have the fusion and have the localization. All right, any other questions? Okay, well, we've hit about our 45-minute mark. That's usually what we try to keep these at. And I appreciate each one that's hopped on. Anybody want to just say hi and talk to people? You're welcome to chime in. All right. Okay, from Josephine, is this kind of therapy ideal for post-surgery? I think that's what you're saying. Yes, okay, because it's still motor alignment. So a lot of times with post-surgery is getting them to feel where their eye is and how to pull that in. Now, one thing that you have to remember about post-surgery is if you have a consecutive exotrope, meaning that they were an esotrope at first, then they had surgery, and now they're an exotrope. What are they? Well, now they're both, but at their heart, they're an esotrope, okay? So you kind of have to think about that in line, that not only do you have to bring their exotropia into line, okay, but then you have to deal with the main reason of why they went esotropic in the first place, okay? So that W scope is great because you can help them to get fusion and then use fusion to bring them to ortho, okay? With the ART, a lot of it's going to depend on that patient and their ability to pull that eye in or let that eye out. All right. Well, thank you so much. We'll see you all in August. Thank you much. Bye-bye.